Hi, welcome to my channel Dentistry with Kashyap. Okay, let's discuss the part 1 series of head and neck blood supply. The main arterial supply of your head and neck comes from your common carotid arteries and vertebral arteries. Before moving into the complex anatomy, let's discuss their main and basic origin. Okay, here you can appreciate your main aortic arch, and here you see the left subclavian and right subclavian, right? Left subclavian, right subclavian. But remember that left subclavian coming directly from aortic arch and your left common carotid coming from your aortic arch directly. And here you see that brachiocephalic branch is originating from your aortic arch, and then it is giving further two branches. One is the right subclavian and the other is the right common carotid artery. As we discussed that the arterial supply is basically from two arteries. One is from common carotid and another from your vertebral artery. So remember, this is your vertebral artery. Okay. This one is your vertebral artery. From left subclavian is a left vertebral, and from right subclavian there is a right vertebral artery. Okay, you have to remember this thing. Okay guys, what we said, we are going to revise it here. The right common carotid arises from your brachiocephalic trunk and left common carotid arises directly from your aortic arch. But at the level of upper border of thyroid cartilage, C4, each divide into internal and external carotid artery. Remember, your right common carotid artery give branches to the internal and external, and left common also give rise to internal and external branches. Okay. Let's see, what does internal carotid artery do, and what does your external carotid artery do? It supplies your brain, orbit, intracranial structure, but not in neck, okay? Internal branches are not the part of your face and your neck, but only deep inside your head, like your brain, like your orbit in eye and your intracranial structures. And external carotid artery, another contrary, which is very important and very examiners loving topic, they supplies your face, scalp, tongue, oral cavity and neck structures. You will see it in detail later. Okay, screenshot this slide and you will get this in your exam if you are a first year BDS student. Okay, it was very hard for me to learn it in my first year, but now everything seems very easy because I make it smart rather than hard work. Okay, there is some mnemonic like some angry lady figured out PMS. Some angry lady figured out PMS. Okay, I have highlighted your initials. There is your superior thyroid artery that supplies your thyroid gland. Then there will be an ascending branch you will see here. But there they didn't mention it, but there from here almost there will be an ascending branch to your pharynx. Then the lingual artery will supply your tongue, facial to the face. This all is a facial. We will discuss facial in detail later. And there is the occipital, like posterior scalp. This supplies your posterior scalp. And posterior auricular, here you will appreciate. And the maxillary, like deep, like maxillary artery, I will discuss in the next part of this video. But there is a maxillary artery, okay? Superficial temporal artery to your temporal part, like part A and part B. Okay. Now let's move towards your vertebral arteries. Like your vertebral artery, we said that it arises from subclavian arteries, that both right from right and the left from left. It arises from subclavian arteries and pass through the transverse foramina of cervical vertebrae. These are your cervical vertebrae and these are your transverse foramina through which this artery is actually passing by. They enter the skull via the foramen magnum. There is a foramen magnum in skull anatomy. Someday I'm going to cover the skull anatomy very easily. But you can learn it now by your own. Unite to form the basilar artery. Okay, in this part we are not going to discuss the arterial supply of the brain. We will cover that in our third part of the video. But remember that it also gave rise to your basilar artery, which is the part of your circle of Phyllis. Okay, the vertebral arteries will supply your brainstem, your cerebellum and posterior part of the brain. We have discussed the facial artery, but remember that some of the examiners will ask you about the facial artery branches, because they used to ask me a lot. Facial artery we are discussing, okay? I have blue tick mark them to make it easy for you. So this is inferior labial artery, like your facial artery is going up there, but it's giving some branches, okay? This is your inferior labial artery, that is a superior labial artery, and that is an angular artery. They mostly like to ask about this angular artery. That is a dorsal nasal artery, and that is a supratrochlear artery. Okay, remember the branches of this facial artery. And here you will appreciate the branches in your neck, like superior thyroid artery supply your thyroid gland. There are tonsillar branches, ascending pharyngeal arches. Okay, ascending pharyngeal artery, which was missing in the previous slide. This ascending pharyngeal artery. Okay, let's summarize the arterial supply of his head. Okay, as we have discussed everything about arterial supply of head and neck, not including the brain, okay? Let's revise it here now. I would like to cover it as interactive rather than as a slide. So let's talk about, guys, you can appreciate here, this is carotid sinus.
This is the internal carotid artery and this one is the external carotid artery. As you appreciate here, this is the external carotid artery. This is the internal carotid artery. We are not going to discuss it, but we are going to discuss everything about the different branches of external carotid artery. Okay. First of all, you are going as a number, but I can revise it more easily. If you go up here, you see there is a maxillary artery. Okay, we will discuss this section of maxillary artery in our next part in detail. Like there are detailed branches of maxillary artery, which is very important as exam point of view. So I don't want to neglect that. I will cover that in next part. Okay, here you see there is an inferior alveolar nerve coming from them, and then you see it's going in the mandible. Then on number 5, you are appreciating here is an ascending palatine artery. And then when you are going by number, then it will be easy. Just like I got this slide. This is very, very beautiful slide, and I got it from from Google. Okay, this one is the ascending palatine artery. This one is a tonsillar artery, and the most important and the legend of arteries in our face is facial artery. So remember, this whole thing is a facial artery. We will also discussing the facial artery very importantly. Like it has some branches. You will see here that it will give you here is a transverse. What is this? Transverse facial artery. This is important. Above the maxillary artery, there is a transverse facial artery. Here you can appreciate or you can palpate on your face. There is a facial artery going down below the angle of mandible or your border of mandible. You can palpate it. Okay, going up, your facial artery is giving some branches. Here is a mental artery. Then it's going down. That is a submental artery. Okay, you are getting my point. This is a mental artery. This is a submental artery. If you go there, you see there are 2 branches. What is this? This one is a superior labial artery, and this one is the inferior labial artery. Then going a little bit upward, you will see what is this. This thing is basically your infraorbital artery. Okay, they have discussed it later. As it is the last number here. But I'm saying I want to discuss it very easily. So if you go upward there, you will get inferior orbital artery. Here you will see some nasal branches. Here you can appreciate the supratrochlear artery, which is in continuation with this. And remember, here is another artery we call as angular artery in the facial artery. Okay? That is very important. Examiner asked that. Inferior labial, superior labial, then angular. Here's the supratrochlear and infraorbital. Remember that infraorbital is a part of facial, but superior orbital. Okay? Superior orbital is not a part of your facial artery. It might be in communication with this later, like internal carotid artery going inside your brain and then giving some branches and then going outside and uniting with your superficial facial artery, so temporal arteries. Okay, that is in continuation with internal artery system. Okay, we have discussed the facial artery, which is very important. Examiner asked that, so you have to learn it very clearly. Okay, going here, as we said, we will cover the maxillary artery in the next part. Then going here is the transverse facial artery. We already discussed it. What is this? What is this? Guess what? What is this? Aortic canal. Okay. So you will see here is a posterior organ. Here might be your ear. Okay, this is the aortic canal. Here might be your ear, and behind the ear, you can touch it behind your ear. There is an artery called as posterior auricular artery. Of course, this is occipital part, so the artery is called as occipital artery. Okay, going up, you can see there. This one is a temporal fossa. This one is a temporal part. So further, it has one frontal part and parietal part. Like what is this? Frontal branch of superficial temporal and parietal branch of superficial temporal. Guys, you have to learn them. Okay, going to the scalp and just moving on your forehead, it is just in communication with your supraorbital artery. Remember that. Okay, as we have already discussed it. If you want to revise it, you can screenshot it. Okay, now see, let's very quick revision once again. Okay, nothing is incomplete without revision. This is your carotid sinuses, this is internal, this is external branch. You see I have 8 branches and you have to remember that some are in neck and some are in face. In this diagram, they are focused on your face. One here you are seeing that is ascending palatine artery, tonsillar artery, there's a maxillary artery, transverse facial artery, superficial temporal further having 2 parts, and this is the posterior auricular artery and the occipital artery. And the most important here is your facial artery, which we have already discussed, 6 branches. Okay, so remember this part. And we are going to cover this thing in very detail in our next lecture, in our part 2 lecture of this thing. In part 3 lecture, we will discuss the circle of Willis, means your branches of internal carotid artery. Okay, along with this carotid artery, some of the branches from the vertebral artery also supplies your brain, your face, and
thank you so much for watching. Stay tuned for the next part. Like I will cover the maxillary artery in the next part and your blood supply of your brain, like circle of Willis, and everything in detail in the third part of the video. And also remember to subscribe my channel and visit my Instagram account, my Dentistry with Keshav. Stay tuned for the next part. It's going to be very interesting.